Our laboratory has developed a translational research platform that's shown here. We use animal models to understand which cancer treatments might cause cardiac toxicity. This is a picture of a zebrafish, which I'm happy to speak about afterwards, but it's a really nice model to study toxicity and mice. And oftentimes we'll use these models to study the effects of a cancer drug on both the heart and the tumor. Because if we're going to protect the heart, we certainly want to make sure that we're maintaining as much anti-tumor activity as we can. And in parallel to these studies, we look in our patients, and through blood sample collection, we try to identify new biomarkers and new protective agents. I'm showing one example here of a study that we've done with one of our lymphoma oncologists, Dr. Mike Lycum. This is a study that was supported by the Heart and Environmental Sciences Institute, as well as the Cancer Survivorship Program at BIDMC. And this is where we used a new technology that can measure 5,000 proteins in a very small amount of blood. And so we took patients who were treated for lymphoma with anthracycline chemotherapy here at Beth Israel Deaconess, and we were able to identify a couple of proteins, and shown here in this paper is currently under revision in a journal, so hopefully it will be published soon. Two proteins, CPVL and PIGR, which correlated with a decline in heart function in patients getting chemotherapy. We then looked in a second group of patients, we saw the same thing. And when we looked in mouse models, we similarly saw that these proteins correlated with heart dysfunction. And so we're excited to follow up these findings and perhaps develop them into biomarkers that could be used for our patients.